I'm Pierre Bergin. I'm the CEO of Marque Medical. This is Dr. Nathan Cascella. He's the president of Marque Medical. And so what we wanted to do is we've been getting a lot of questions, a lot of employers reaching out to us, asking, how do we get people back to work safely? What are some protocols? Are these testings effective that we're seeing? What's the difference between an antibody test and a diagnostic test? What's between rapid and lab sent tests? How accurate are they? And these are all the right questions to ask. And so, we've been honored to take care of a lot of those people in the community of these questions for the last several months now. And so we thought what we do is just kind of share some information that we've seen from employers regarding how do you properly check for temperatures? How do you protect the staff that are doing the temperatures? What's a good safe return to work protocol? How do we make sure that we're keeping our employees safe, not just now, but in the foreseeable future? And so I got to say one thing, nobody has 100% of the answers right now. I think as a medical group, we're finding out information every day. Things do change. I think we're seeing less and less changes coming from large groups like CDC and WHO as far as, how this disease is spread, safe practices. So if there's any silver lining, I think we're getting a little more familiar how to keep people safe. I think as Dr. Cascella is going to show too, you're going to see some of the curves kind of move in the right direction so we can get back to work safely, get America working again. And a lot of you guys are chamber members, and so we thought we'd speak to you from a business-to-business perspective on, how to protect your companies and really how do you get back to thriving right before all this happened. So we're going to go over kind of an introduction into the current state of COVID-19 and kind of what we're seeing out there. Dr. Cascella will share with you some of that data. We're going to have two of our medical assistants and office managers come in and talk to you about, wearing PPE, how to don and doff it safely, how to take temperatures checks. These ladies are wonderful. They've been with us for years, so you couldn't find better people to do that. Dr. Porge is going to talk about kind of safe return to work protocols, testing. He's going to talk about methodologies to employ within your company, either time-based or testing-based methodologies, what to look out for, how long do they have to be at home. So we'll spend about 10 minutes on that. And then we're going to go over a couple of Q&As and kind of intermingle some safety features throughout the whole process. And so, again, we do appreciate your time here. Again, we're here for you guys if you need us. This is not a pitch for Marque Medical. This is a pitch for a safe return to work. If you've got a medical group that you use and you trust, great. If you want to explore our services, great. But more importantly, we really want to see everybody getting back to work and want to see them done safely. So without further ado, I'd like to turn over to Dr. Cascella, who's going to talk about kind of the current state of COVID-19 and maybe share some perspectives with us. So thank you, Dr. Cascella.
Yeah, perfect. Yeah, my name's Dr. Nathan Cascella. I'm a board certified physician and I'm president of Marque Medical. I just want to talk to you guys or get things started a little bit about COVID-19 and why it's called COVID-19, what it is, and where we are, kind of state of our area, just from the world perspective, as well as our country, and then our communities and our local counties as well. So without further ado, for those that probably know COVID-19, what does that mean? What's the official name? Well, it's named after a disease, coronavirus disease. And so, and it was first encountered in 2019. That's why the 2019. So the disease is the coronavirus disease 2019. If you take the first two letters of corona, CO, first two letters of virus, VI, and then D for disease, they came up with COVID-19. The actual virus is called subacute respiratory, severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2. And so that's the name of the actual virus. So just like AIDS and HIV, HIV is the name of a virus that causes a disease called AIDS. And so you may see those two names, and that's the difference of them. Why coronavirus? Well, if you look at a microscope at the virus, it actually has all these little coronas on them, or halos, and hence the name coronavirus. And so that's where we came up with that. As of this morning, June 2nd, 6:33 this morning, according to Johns Hopkins University, worldwide cases are just over 6 million. In the United States, we have about 1.8 million. And here in California, we have 114, almost 115,000 In Orange County, we have 6,474 cases. In San Diego, we have 7,554 cases. If we look at Orange County specifically, as of yesterday, June 1st, total cases were 6,474 in our area. That includes 665 skilled nursing facilities and 377 cases in Orange County Jail, amongst Orange County Jail inmates. As far as cases reported yesterday, there's 213 cases reported yesterday. Cumulative deaths to date in Orange County include 147. A good number, though, very, very good number to see, is that as of yesterday, there were 0 deaths reported in Orange County. As far as tests done in Orange County, there's been 132,075. And as far as tests done yesterday in a day, 1,140. As far as hospitalized patients, can't see that number there, but it's 240, which includes 97 cases in the ICU. And then we've got just a little over 2,000 people that have recovered here in Orange County. As far as San Diego, this slide may be a little bit too much here, and so I'm not going to really go over these numbers. I just wanted to include it because we do have some clinics. Marque Medical has some clinics in San Diego, and so we are sharing this information with some chambers down there as well. And so I included this slide for them, but I won't go over those numbers. That's just for them to look at in the future. So this graph, again, may seem a little confusing, but this is basically the outbreak evolution for the current 10 most affected countries. So if we take the 10 top countries and have a new cases every 5 days moving average, that top line, green line, that's the United States. So if we look from around mid-March, about March 15th, up through the end of May, we can see that we had a huge upstroke about March 15th to the end of the March, where we went from nearly no cases to about 38,000 cases. And then through April, the month of April, kind of steadied off. And then in May, started to drop off. Of course, that curve is not a perfect curve. It's kind of a jagged zigzag curve. But if you kind of look at it from a whole perspective, it does show that it is coming down here in the United States, and that's a good thing. This slide, again, something may seem very confusing, but if you look at the very top line, the red line, that's the United States. And basically what this is saying is from January 21st, 2020 to today, June 2nd, 2020, that the United States, the overall cases has been, the curve that has been bent. We are bending that curve, and it is flattening out. And so the things that we are doing are working, exciting, because now it's time for us to move forward and kind of get people back to work. And that's why we're here today. And so as far as getting people back to work, I do want to introduce a couple of our medical assistants that are going to talk about how to protect your staff so your staff can protect themselves if they're taking temperatures, how to put on protective equipment. I do want to say one thing that I'm very, very proud of is from day one at Marque Medical with the different clinic urgent cares that we have, we set out as safety for our staff. Staff has evaluated thousands of patients at our locations over the last couple months, taking temperatures, and proud to say that we haven't had one single case in our urgent cares or in our staffs that have contracted the coronavirus. So these methods that they're about to share with you, these are given by the CDC. These are proven methods to make sure you're protecting yourself. And so I really encourage you to pay attention to them and what they're about to share with you, and let you know that if you do, you will be safe as far as protecting yourself and your staff. And that's the most important thing here. So I want to turn it over to Janelle and Jessica. They're going to come in and teach you guys a little bit about donning and doffing.
Hi, everybody. So we're going to go over how to don and doff your personal protective equipment. To don means to putting on, and doff is taking off or removing your personal protective equipment. So the first thing we're going to do is demonstrate how to put on gloves.
Step 1. You want to take a glove from the dispenser, touching only a restricted surface. Step 2. Hold the wrist end open with one hand and ease the fingers of the other inside. Step 3. You want to repeat this for the other hand. Now that we told you how to put on gloves, we're going to tell you how to doff the gloves, take off the gloves. So step 1 is you want to grasp the outside of one glove at the wrist. You do not want to touch your bare skin. Step 2 is you want to peel the glove away from your body, pulling it inside out. Hold the glove you just removed, just like what Jessica did, in your gloved hand. Then you want to peel off the second glove by putting your fingers inside the glove at the top of your wrist. Perfect. And then turn the second glove inside out while pulling it away from your body, leaving the first glove inside the second. And then dispose of the glove safely in the trash can. Do not reuse the gloves. And then of course, you want to clean your hands immediately. Soap and water is preferred, but if you do not have soap and water, hand sanitizer is the method to go. Okay, so we do want to go over how to put on a mask because there is certain ways and steps to take on how to put on a mask. So you first want to wash your hands before putting on any protective or personal protective equipment. So Janelle does not have soap and water in front of her, so she will be using hand sanitizer. So what she wants to do is she first wants to take a procedure mask out of the box. And she wants to place the mask over her nose and mouth. Perfect. Pinch the nose clips on the nose. Perfect. So it secures around your nose. And then you want to loop, like she has right now, you want to loop around your ears. You want to avoid touching the inside of the mask. You just want to touch the outside of the mask around your nose. And then of course, if you touch the front of your mask while putting it on, which you did, you do want to wash your hands or Purell after you put on your mask. So how to take off your mask is you want to grab the mask from the ear loops. You do not want to grab the mask from the front of the nose, taking it off. You do want to take it off from the ear loops, just like Janelle is demonstrating, and you want to pull it straight off your face. And then you want to place the mask straight into the garbage. And then of course, after removing or placing any personal protective equipment on, you do want to wash or sanitize your hands immediately.
Now I'm going to put on the face shield by touching the outer portion of the face shield. And you put on a slip. Now I'm going to remove it. You also want to only touch the outer portion of the face shield, not touching the front of the face shield. You want to place it down upwards like this. And to take off the goggles, you want to touch only the tip of the outer glasses, not the front of the glasses, and then place them down this way. And then you wash your hands after.
Perfect, thank you, Jess. Now we'll be demonstrating how to put on a gown. You want to make sure the gown fully covers your torso, from neck to knees, arms to ends of wrists, and it wraps around the back. Then you can fasten the gown with the ties in the back of the neck and around the waist.
So when you're putting your gloves on, you want to make sure that it goes over your gown. So just like so, up and over. So that way, underneath your gown is or underneath your gloves is protected.
Anything else you want to say about putting on your gown?
So when you're putting on your gown, just make sure that you're fastening it well. Make sure it's going over your neck. And then when removing it, we'll go over that later. But just make sure that it's covering the clothes that you're wanting to protect.
Excellent.
So when removing your gown, the first thing you're going to have to do is we're going to be removing our gloves. So just like how Jessica showed earlier in the video how to remove your gloves. So we're going to pinch in the middle, pull off, bring it to a ball, underneath the glove, pull off, and then dispose. Now I'm going to untie from the back, because remember, the back of my gown is clean. It wasn't touched or coughed on by a patient. So now with my bare hands, I'm going to grab the back of my gown. And then now we're going to untie the top. And then from there, without touching the front of my gown, get my arms out and pull it off safely and dispose of it.
And then what if you do not have a gown?
So if you don't have a gown, you want to make sure that you're wearing something that obviously that you're okay with getting dirty. Something that you can take off easily, put in a bag before you head home. So we want to make sure that, you know, what we're wearing, if we're going to be taking temperatures, is something that we're not going to be taking back into our house. So I would either wear like a t-shirt or a long sleeve shirt that I can just remove after I'm done taking temperatures, put it in a bag, and then take it, put it away, and then take it into my house and then wash it right away.
Excellent, thank you.
So when reusing your personal protective equipment, Jessica's going to put on her personal protective equipment first. So it's the same steps as putting it on. Make sure to fasten everything, put your gloves on. Just tie her real quick. Okay. So Jessica's going to continue putting on her personal protective equipment. So when reusing your personal protective equipment, the only thing that you can reuse is your gown and your face shield and your goggles. Remember, you cannot reuse your gloves. So once she has everything on, we'll show you how to take it off and reuse everything. Okay, so now she has all her personal protective equipment on. She's done temp checks, and so now she's going to remove it. So the first thing she's going to remove is, with her gloves on, is going to be her face shield. So she's going to remove her face shield, set it down. Then from there, she's going to remove her gloves, just how we showed you guys earlier. And then now she's going to remove her goggles without touching the front of them. And now her face mask. And then now the last thing she's going to remove is her gown. But this time when she removes her gown, she's going to place it over the table so we can sanitize it. Okay, so now that she's laid the gown over the table, at this time we would either grab Lysol or some kind of disinfectant spray, spray down her gown, spray down her mask, spray down her goggles, and also spray down her face shield. You let it sit for 15 minutes. After it sits for 15 minutes, then the PPE is ready to be reused.
Now we're going to talk about how to properly use hand sanitizer, because there is, in fact, proper ways how to use hand sanitizer. So the first step is you do want to apply enough hand sanitizer to completely cover both hands. Now you want to rub your palms together pretty frequently. Rub the back of each hand with palm. Rub the back of each hand and the palm of the other hand. And you want to spread the sanitizer over and under your fingernails, just like how Janelle is demonstrating. You want to spread the sanitizer between all your fingers. And you want to keep rubbing your hands together until it is completely dry. If you seem to have hand sanitizer that dries within 5 to 10 seconds, you did not use enough hand sanitizer. Hand sanitizer should be able to dry within 15 or more seconds. So you want to make sure that you are using enough, that you're spreading enough, and you do not want to dry your hands after hand sanitizer. You do want to rub it all completely into your hands until it completely dries. Then you know your hands are disinfected. Okay, now we go into temperature checks. So many of these employers, such as yourself, have started screening employees' temperatures to ensure that that employees with symptoms of the illness do not infect their coworkers. So temperature checks are widely used as a public screening measure at international airports and in parts of Asia, and is now widely adopted as a tool to screen employees. So the first question that you should ask is, who should conduct temperature checks? Ideally, you would have a trained medical professional, but for employers that do not have a trained nurse or medical professional on site to conduct temperature checks, the employer should designate one or more management level personnel to conduct the testing. So before considering temperature checks in your business, ask yourself the following questions. Who should take the temperature checks in your business? How will that employee be protected from the virus? And how will the privacy of employees subjected to temperature checks be protected? Once you have identified who will administer the scan, the employer should provide the administrator with proper protective equipment, or PPE. The best equipment to give an administrator are ones that require no contact between the temperature taker and the employees. So what PPE is good for my business? So the best practices. So temperature scanners that they have now can accurately measure temperature remotely. So the most ideal is what Janelle is holding. It's these forehead scanners that they minimize the amount of contact between the temperature taker and the employees. If you're having issues sourcing these type of thermometers, any type of thermometers is perfectly fine, including oral or the ones that go in your ear. The other PPE that is good for your business to protect the temperature administrator and your employees is obviously gloves, masks or face shields, eyewear, and gowns. But like what Janelle had said, if you do not have gowns or face shields, the most important things to have is gloves, masks, and thermometers. So conducting temperature checks. So the best practices for conducting a temperature check is the administrator should perform a test run on him and herself to ensure he or she does not have a fever before performing temperature checks to any employees or staff. That would be bad. Instead of lining employees up to get their temperature taken, the administrator should take an employee's temperature as privately as possible and keep the identity of any employees with fevers confidential. And then administrators should learn how to disinfect the thermometer before and after use, which Janelle will demonstrate. You want to get disinfecting wipes or some sort of disinfecting agent that you can spray into a paper towel, and you want to properly disinfect if you have an oral thermometer, an ear thermometer, or an infrared thermometer like the one Janelle is holding. Now, just to reiterate, so disinfecting, you want to make sure that the surface is wet with whatever you're disinfecting, and you want to let it dry. You don't want to disinfect anything and then use a paper towel to dry it. Just like hand sanitizer, that will not disinfect it properly. So you want to make sure that whatever you're disinfecting, you want to make sure it air dries and for at least 15 to 20 seconds. And then finally, administrators should learn how to troubleshoot inaccurate temperature readings. And that's really based on what you use, what thermometer you use, and there are directions for each thermometer and what you buy.
There's also some issues that you might run across with some thermometers. So if you're getting really, really low temperatures or really, really high temperatures, it could be that the batteries just need to be changed out, Or it could be, especially with these infrareds, it could be that maybe the patient just came in from outside and it was really, really hot. You might want to have them sit down and rest for a few minutes. Or if they're coming in from a really, cold area that was high with the AC, then just have them sit and rest for a minute. At least take the temperature at least 3 times to get an accurate reading.
Okay, now we're going to have Dr. Kiskila come in, and he's going to answer what constitutes a fever.
Yeah, sure. So officially in a medical textbook, a fever is 100.4. Normal is 98.7. So, the gray area or low grade fevers, we'd say between 99 and 100 or 100.4. And so anything really over 99.9, like 100 and above, would be something that you'd want to at least recheck, maybe have them sit there and cool down for a little bit. But officially, a fever, like I said, medical definition is set at 100.4.
All right, thank you so much. Okay, so another big question that a lot of employers have been asking is, should I keep a record of these temperature checks? Now, the best practices are, so while employers are permitted to take temperatures during this pandemic, if the temperature of the employees are recorded, that information must be maintained confidentially under the ADA and provided to those who should have knowledge of the information. Employers can also consider simply recording no, meaning the employee's temperature is under appropriate threshold, or yes, meaning the employee has a fever of 100.4 degrees or above. For each employee, instead of recording each individual employee's specific temperature on any given workday. Regardless, the information that is recorded should be treated as a confidential medical document and not placed in any employee's personnel file. Okay, so final thoughts about temperature checks in your workplace. So note that taking employee temperatures and screening employee for fevers is not a silver bullet against the spread of COVID-19. There is so much that the medical community does not know about COVID-19 and its spread. Current medical information suggests that individuals without any symptoms, example, asymptomatic, may nevertheless be infected with COVID-19 and still transmit the virus to others. So for this reason, taking temperatures does not eliminate the need for practice to maintain other steps to avoid the spread of the virus. Maintaining a social distancing best practices, including promoting remote work as much as possible, maintaining adequate distance between employees who are in the workplace, frequent hand washing and disinfecting, and frequent cleaning and disinfecting of common areas and touch points throughout your workplace. Okay, so employers should do all they can to keep employees at least 6 feet apart. Physical distance barriers, signs, tape marks, or reminders throughout your workplace. You might want to consider staggering shifts, start times, break times, so you don't have a lot of employees meeting up together all at one place at the same time. Recommending face coverings, cloth coverings in common areas or places where there is a lot of people gathering at once. You do want to consider banning of hugs, handshakes, fist bumps, the air hug, the virtual high five, things like that. That has no spread of the virus. And then also, you want to consider maybe eliminating or considering extra cleaning to coffee pots and other shared items in your break room, copiers, printers, things like that. Okay, so thank you so much, Janelle and Jess, for your demonstrations. Right now, we were going to have our medical director, Dr. David Porzio, come and explain employee testing and some safe to work protocols.
Okay, so let's talk about COVID-19 diagnostic testing. So currently, our samples are sent to a lab or performed as a point of care test. Obviously, the point of care testing is more popular because we can get it done very quickly. There are 3 currently approved point of care tests that are what are called CLIA waived, meaning we can do them in the clinic themselves. The most common way to do this is through the nasopharyngeal swab. And that, like I said, you can swab and send to the lab, and usually your turnaround will be about a day to 2 days, or you can swab and do the point of care and the results should come back within about 30 minutes. The tests are very good. What we call the sensitivity is about 99%, meaning a positive test truly represents a true positive, and 99% specificity, which would tell you that a negative test is a true negative.
Oops, sorry.
Now, one thing in terms of nasal swab testing, currently when we send the swabs to the lab, those tests can, in about 15 to 35%, show a false negative. It depends on when the testing is being done, but you can improve the predictive value of the test by doing it twice. So you do it the first time and then wait about 24 hours and then do it a second time, and 2 negatives over that time frame is about 99% accurate to say the person does not have COVID-19. So what are the strategies for testing your employees to see if they have COVID-19? And it all depends on the industry you're in and how close your workers are to each other. But you can perform one lab test sent as a rapid point of care, or you can do 2 tests, like I said, separating them 24 hours apart with a 99% accuracy, or you could combine antibody testing with point of care. So if you have somebody that was, let's say, exposed, and it was at least 7 to 10 days after their exposure, you could do a simple either point of care swab and antibody testing to determine either if they had active disease or if they had exposure and now we're demonstrating antibodies in the bloodstream. So what do you do when someone's been exposed? The first thing is the definition of close contact for your exposure. If the employees were within about 6 feet of each other for more than 15 minutes, then you consider that close contact. If they don't meet the definition of close contact, then just having them continue to monitor their symptoms and temperature and come to work regularly is fine. But if they do fall under the close contact definition, then the recommendation would be for them to go home and self-isolate for at least 7 days from the point of their exposure. And that gives them time to either develop symptoms or to actually have the virus start replicating so it can be picked up. Understand that people get this virus and don't have symptoms a lot of the time. And so you want to time your testing so that it's done at a point where you know the virus will be active in them, which is at least 7 days after a known exposure. You can do your testing anytime after someone develops symptoms. So an exposed person goes home, they are isolated for at least 7 days. At that 7-day mark, you can do either the 3 testing strategies we talked about, 1 swab or 2 swabs with a 99% accuracy of saying they don't have it, or a swab and an antibody test. If the person was exposed and starts developing symptoms, then they have a 10-day isolation clock start at that moment. So from the moment they develop symptoms after their exposure, then 10 days from then is when their isolation would end. You could also do any of the 3 testing strategies at that point to determine if that was actually, if their symptoms represent an active COVID-19 infection. So next. So if you have an employee that was exposed more than 7 days ago, that person could, and certainly if they haven't had symptoms, that person could go straight to the testing we already talked about, those 3 different strategies. And then they should continue to monitor themselves for symptoms of COVID, including fever, and as we've talked about, temperature checks in the workplace are especially appropriate. So what do you do when you have somebody who's tested positive? So someone who's tested positive who doesn't have any symptoms, how do you get them back into the workplace? So there's basically two strategies for doing this. There's a time-based strategy, and then there's a testing-based strategy. So time is really based on the moment you had a positive test, and we talk about a 10-day isolation period. So from the moment you have a positive COVID-19 test, it's 10 days of isolation. And that means isolation in the home, isolation from others within the home, using their own bathroom. There's a whole bunch of recommendations on how to protect everyone within the household for someone who has a known COVID-19. With that in mind, they stay at home for 10 days. If the final 3 days, the last 72 hours of that 10 days, is without temperature, without fever, without symptoms, then they can end their isolation at that point. We'd want to see them on a virtual visit or they should be seen by some provider on a virtual visit to tell them, yes, you've met the criteria for going back to work and so forth. Now, the testing-based strategy, and this is something you might want to use in more higher risk populations, those that are going to be potentially exposing elderly and vulnerable populations. And those individuals, you may want to take the strategy of the two-test method, which says after their 10 days of isolation, the final 3 days without symptoms, that they're tested. And they have to be tested negative twice, and those two tests need to be separated by a minimum of 24 hours. At any time, if the test is still positive, then they would have to stay in isolation. Current recommendations are a continued 7 days of isolation until they have those two tests negative consecutively. And again, they'd want to be seen by a provider at the end of that to be cleared and given an appropriate return to work note. Now, for those who have symptoms and test positive, the timing of the ending of their isolation really can be based on either when the test was done or when their symptoms developed. If their test was done first and they developed symptoms a few days afterwards, then you'd want to use the date that their symptoms developed, because that's really the marker of their illness. And so 10 days from that point would be when you'd want to end their isolation. If they developed symptoms before their test was done, you could either use the date of symptom onset or the date of the first positive test. I'd probably prefer the first positive test, as it provides a little longer isolation period. We're still not sure how long these people are infectious for, and the longer, ideally, you could keep someone away from others and infecting other people, the better. But regardless, you would follow that strategy of the final 3 days of the isolation being symptom-free, no fevers, and no other symptoms, and then they could be released back to work with an appropriate evaluation and return to work note. For those who are healthcare workers, again, we would recommend a double testing strategy where you test at the end of 10 days of isolation and then about 36 to 48 hours later. And if both those tests are negative, they can safely go back to the workplace. If not, they probably should isolate a little bit longer and be retested.
Now we will be moving into Q&A.
Out of the 6,474 cases, I'm assuming that's in Orange County, how many are currently in nursing homes?
That was at 20%. About 20%, I believe, was the number.
Okay, so 20% of 6,474 cases were coming from nursing homes.
From skilled nursing facilities, yes.
So
SNFs.
1,200 people.
Okay.
And the mortality rate was 45%, so quite high amongst those individuals.
Okay, great. Okay, so we have another question. So if the thermometer is touchless, does it still need to be disinfected between each use? That is a great question.
Yeah, it's a great question. I mean, we recommend yes, just to be on the safe side. And so some of these droplets could, spread even though it's not being touched up to 6 feet, or at least that's what we believe. And so since it is getting within that 6 feet, then if that person was spreading the virus, could it attach that thermometer and need to be disinfected? We would say yes. And so yes, we would still want to disinfect it between each use. And replace your gloves, obviously, as well, between each use, either way.
Okay, great. Let's say we have another question. How often do you recommend the testers get tested? So the administrators giving temperature checks.
Yeah, I'll let
Well,
Dr.
you know,
Porzio answer that.
I wouldn't necessarily advise routine testing of the testers. I mean, everybody should be following the same guidelines in terms of monitoring symptoms and temperature. But if they're wearing proper PPE and donning and doffing it properly, the risk of getting it as being the tester's negligible. We're not really seeing anybody who's doing that. It's really, a lot of it has to do with the viral load that you're exposed to. That has been clear. That the sicker you get, a lot sicker, the more virus that you're exposed to.
Okay, we have another one. So if someone has a fever when they show up to work, what do you do? Just send them home?
Yes, yes, I would send them home and have them contact a medical professional or provider for guidance. Obviously, that's something that we do and we're happy to do. But until you figure out what the culprit of that fever is, you would want to err on the safe side and have them go home and not come into work until talk to a medical professional to determine best course of action.
So I would piggyback off of that and say a fever is only the symptom of something. It's not a disease in and of itself. It's just a symptom of something you have. And influenza causes fever, strep throat causes fever, ear infections cause fever, and coronavirus cause fever. So as soon as, that's why it's the one little deflection point we seem to get is a fever. So if you have a fever in the era of COVID, we would presume you could have COVID and we would send you home and say, come and do a virtual visit. You know, we have that technology. We can see people virtually from their home. And that way they stay safe and we stay safe. And then we can direct them to a proper testing facility. That's why we've set up drive-up testing facilities so people can come, drive up, get tested, again, without exposing our employees to the risk of acquiring the test and keeping them safe as well. But that's how someone with a fever should be treated. It should be presumptive COVID-19 until proven otherwise.
Okay, great. Thank you so much. You have another one. So what about mass screening? If our company fears infection, is it worth it?
Yeah, well, so I think that the answer to that question depends on whether or not there is a cluster of cases within your facility. If you have someone who is positive within your facility, then certainly you have to look at the people who were exposed in close contact with that individual need to go home and wait to develop symptoms and then be tested. But I would not recommend a mass screening of everybody in the building based on that, or if no one has the virus. The right way to go about it is screening at the door, temperature checks, monitor symptoms.
Okay, great.
Great questions.
Do you have anything to add to that?
Yeah, again, it really comes down to your company and your business and what those demographics look like and what the proximity of everybody is. Some companies have reached out to us for mass screenings, and we have done that, and we're happy to do that, and we're capable of doing that. And but they just determined between themselves that was the right thing to do for them. And so again, I think it depends a lot on what your company looks like and what the situation is. And if that's the case, we'd be happy to help you through that.
Okay, great. Thank you so much.
So thank you everybody for joining today. We know you guys are busy. We thought maybe we'd just give you some information that would help keep your company safe. Again, our objective here is to get America back to work safely as possible. We're here for you as a resource. There's a lot of great other urgent cares in the areas, great medical providers. I think the key is make sure you have some type of relationship with the medical group during these times. So you have go-to resources. Some groups such as ours have hotline numbers we can call a COVID and ask questions. I've seen that happen from a lot of large insurance companies as well. But there's a lot of resources out there. CDC is changing things. Often they're trying to update you. So, check the CDC website. As we mentioned in the beginning, there's a lot of testing out there. And what I'd recommend all employers do is do your due diligence on the testing. Not all rapid tests, not all rapid antibody tests are the same. Not all labs process things the same. We try to do our due diligence to find things that are meaningful and safe with high accuracy rates. I think a lot of groups try their best to do it, but do your due diligence then as well. If you have any questions, please reach out to us. We're here as a resource. Again, a lot of you guys are chamber members, so we're here for you. San Diego as well. Please contact us or any clinic down there. And so, like I said, let's be safe. Let's get back to work. Let's take some proper safety measures. Let's kind of get through this. So we do appreciate everyone's time today, and we'll be in touch very soon. Again, any questions, please contact us. So thank you, everyone. Have a great day.
Thank you.